Hey there, happy Friday. Thank you so much, as always, for coming along this little learning journey that I'm on, that our whole team was on at Reactive. My name is Julie Hirschberg. I am the founder, the owner of Reactive Therapy and Wellness in the Los Angeles area. And it is our mission really to help people who have neurologic disorders recover the movement and strength and confidence um, in a way that is truly changing their brain. And it's really just my joy and honor to do this. We also do a lot of this through education of other therapists. And that's why I hop on here every week to chat about some of those things that are unique and different and that we're learning and we want to share with the world. So I'm so excited to chat with you today because we had our Autonomic webinar last weekend. By the way, I'll put a link in here for you because it was phenomenal and we got so much feedback, like really great feedback on it, that I had to talk about part two today. I had to go on more. In fact, our webinar went on long because there was such great interaction and questions and all of that. And we wanted to do so much more. So that's what we're going to do today. I've been really obsessed with the autonomic nervous system, as you've known, for probably the whole last few years. But for me, really recently, as I've read more books and more literature and done more training, it's just been a really great area of growth for me. And in our webinar, we presented a framework, and I'm showing you this here. This is a little cheat sheet that goes out with our webinar, by the way. So if you haven't seen our webinar, sign up for it. You get the webinar, you get a cheat sheet, you get our handouts, you get recordings of some of the practices that I'm going to talk about today, like so many great, great resources for you. So check it out. But this is an awesome resource. Our student put it together for you. So shout out to Will. Thank you so much. But we presented a framework of thinking about the autonomic nervous system and assessment and treatment. And it's essentially set up through 4 levels based on the anatomy. So we've got the spinal cord and peripheral nervous system. We've got the brain stem here. We've got the hypothalamus and HPA axis, and the top level, the limbic system. So when in our webinar, we talked about assessing in each of those areas and treating in each of those areas. In the webinar, we went through, and these are the 3 recordings, by the way, you'll get when if you get the webinar. We've got box breathing. So that's a breath work technique where you're breathing like a box. So I like to think of it as like an inhale for 4, hold for 4, exhale for 4, hold for 4. So you're making a box with your breath. So Naoya, our OT, did an amazing job leading us through that. He also led us through a grounding exercise for grounding to the breath. And then finally, this was the most awesome, he led us in guided imagery specific for Francis, who was in the East Coast and had a Cape Cod memory, and he led through this really awesome guided imagery. So those 3 recordings are available for you. And especially, I would say, if leading somebody through some of these autonomic practices has felt uncomfortable or you're not sure where to start, use those. Like, use Naoya's voice because it's pretty phenomenal. So those were a few of the activities that we did in our autonomic webinar, but I wanted to go through some more specifically things that are on our cheat sheet here at the different levels, 1, 2, 3, 4. So let's start with level 1. And I think this is the level most people think about. That's the spinal cord and the peripheral nervous system. So all of that, like parasympathetic, sympathetic, the vagus nerve, which is very, very famous right now, I would say. So I wanted to give you a couple of ideas that have been really helpful for me with people this week and generally speaking. So one, and this is non-vagus nerve related, one thing that we can think about with the autonomic nervous system is actually our vision and our pupils, right? And how much visual information we might be taking in when we're in a sympathetic versus parasympathetic state. And sometimes, particularly when this is causing some visual dependence or visual sensitivity, we may actually need to decrease some of that. The autonomic nervous system perhaps has been set up to take in too much information. One of my favorite things here is to temporarily, and it's not a long-term solution, but temporarily decrease some of the visual information. So we do this in therapy. The half body classes are my favorite thing. So these were actually developed for sports, for baseball pitchers actually, to promote a head down position. And you can put them on, they're almost like kind of a goggle, and they got black out at the bottom. So it decreases the visual input. This has been really nice. I've been using that with people like for screen sensitivity and even just everyday movements is to try to just decrease that level of visual input. I also really love on that visual realm of things, I also love working on some of the eye movements in a very automatic way, so less vigilant way. One of the things our autonomic nervous system really does is can make us very purposefully highly vigilant visually. And so I love using games like a ball toss. We've got this great little headband punching ball. I love both of those for automatic eye movements. And so that helps to decrease some of that, that visual vigilance that our brain might be doing in a sympathetic state. So that's level one. Level two on our brainstem. So this is where all of those lovely vagal nuclei, the dorsal motor nucleus of vagus, the nucleus ambiguus, the solitary nucleus, all of those live in the brainstem. And huge portion of that autonomic control in the brainstem is cardiovascular. And there has been some really great research. I'm gonna put in a link here actually to a systematic review that looked at high intensity interval training. So I'm going to pop that link in here too. High intensity interval training for cardiac autonomic dysfunction and looking at specifically, does the heart rate variability change with that? And yes, it does. So heart rate variability is one of kind of the ways we can take a pulse on the autonomic nervous system. High intensity interval training, graded exercise is a way to be able to train that. So just in a different way, but like our breath work and our grounding train the autonomic nervous system, so can graded exercise. So I got to tell you, I was working with Katie, one of our therapists in West LA today, and she just did an amazing job of setting up kind of a graded exercise program with somebody using some of their martial arts moves and doing intervals. So it's a minute and 30 seconds and a minute and 30 seconds. And that is precisely it. And starting at very, very low dose and ramping up, especially for an autonomic system and a body system that might be not very used to exercise. So that is one way, and a very specific way, specific to what people love, to do some graded exercise. Now let's move up the next level, hypothalamus. So, one of the things that I really love with the grounding is bringing in an external focus. So, grounding exercise can be really helpful for these systems. External focus can also be really helpful at all levels of the autonomic nervous system. So, again, Katie, amazing today. I'm going to bring up all of Katie's ideas because they were awesome. And we really collaborated with the patient with these. Having a ball on the belly. And with breathing and trying to increase a belly breath or the depth of the breath and the slowness of the breath, having the external focus to push the ball away, move the ball, roll the ball while breathing was a really lovely practice. Very, very simple. So good. And then finally, probably most importantly, is the limbic system. And here we can work on activities, maybe activities that we're working to trying to improve with graded exposure and in a really joyful way. And again, Katie with the win in we were working on some walking and she had made the suggestion stepping over an external object, super helpful. This person's walk immediately changed when we did this a couple weeks ago. And then she made a suggestion to actually use specific playing cards that he likes to play with, and then to identify different characters and characteristics in those cards as he was stepping over. So not only great physical activity, great external focus, but bringing in the joy, bringing in the fun, bringing in the salience and the autonomy to that activity, like all of the things all at once was really, really great. Another wonderful way to do this, if this is also part of what the person loves, it certainly is for me, is with music. It gives an external focus and just rhythmic body movement. So I actually have a rocking board now here at my standing desk. It's a really small one, but that rhythmic movement, if I'm working on something, I'm getting stressed, actually doing that while I'm in that state can be very helpful to me and help kind of keep me in that safe and secure zone, just like we did rocking babies, right? So those are some ideas from each of the levels 1, 2, 3, and 4 of our autonomic nervous system, all in our cheat sheet, by the way. I could go on, and we will, because this month is our autonomic month in our Brain Bites community. So I'm definitely going to be coming to you the next few weeks. Next week, actually, next Thursday, we have a guest, Rob Lundell, who is an expert in cervicogenic dizziness. So I'm so excited because he's coming to our Brain Bites group. So on Friday, I'm going to be talking about it. So I'm going to bring all the wisdom, everything we gained from Thursday next week. The following week, we're going to talk more autonomic cases. So more autonomic nervous system coming to you the following week. And then in our Brain Bites community, we're having, I'm so excited for this, a special expert researcher on the gut-brain connection. I have a lot of questions. I know a lot of people have questions about this area. And so we're going to learn about it, and then I'll be sharing it on Friday. So this is all happening in our Brain Bites community. You've likely heard me talk about it. This is a community of other physical therapists, occupational therapists, chiropractors, fitness professionals who are really dedicated to learning some of the things like this, like the autonomic nervous system, that we don't get in school. And that might be kind of tricky, but are so, so important. So we're having Autonomic Month. Maybe you want to join us. It's actually your last chance. So our Brain Bites community is open through today. It's Friday, May 7th in 2021, and we close our doors today. So if you are interested, you should join us today. Otherwise, let's just stay in touch. I'm going to be hopping in here every Friday to share all that I love. And I'm so appreciative of you being with me on this journey. I hope you have a great day and a wonderful weekend.